Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, PA. So this week in our video, we're going to talk about what I did in the blog on Monday, and that's spinal decompression, and that's what we offer here at our practice. So as you can see, this is our spinal decompression table here. This is called the DRX 9000. This is a lumbar unit. We have another one right next door right here. We have another one in a room back here. That one's a combo unit. That's for lumbar and cervical patients. So we have 3 spinal decompression tables at this office. So this week what we're going to talk about in the blog, I'm going to go through spinal decompression. I'm going to talk a little brief history of it, what we do in our office, and what kind of conditions that it treats. So without further ado, let's talk about this. So spinal decompression was actually developed by a medical doctor, not a chiropractor. The medical doctor that it was developed by was a Canadian doctor named Alan Dreyer. He's one of the biggest well-known doctors in the Canadian field. So this is not the table he developed. The table that was developed, this one, the DRX 9000, was also by a medical doctor. He was a neurosurgeon. His name was Dr. Norman Sheely. He developed this back in the mid to late 90s, and then it just took off from there. So what we'll do now is let's just talk real quick about what types of conditions spinal decompression treats. So a lot of different things. Big ones: disc bulges, disc herniations, spinal stenosis, which we'll talk a little bit more about these conditions when we go through the blogs each week. Degenerative disc disease, facet syndrome, and really the biggest thing, chronic pain. Patients who have been in pain for so long, nothing has helped. Opioids, injections, surgery. People with failed back surgeries come in here and get treated for our protocol here. Sometimes these different treatments don't help, and sometimes this was the solution all along. That's why we tell patients sometimes surgery is not your best solution. Now, we're in no way, shape, or form bashing the medical field, but these injections, these surgeries, the opioids, they're only numbing the pain. They're not actually eliminating the problem. And in fact, decompression has a 93% success rate, where surgery only has a 20% success rate. I can't tell you how many patients we've actually seen come in here with a failed back surgery. We get them through the decompression protocol, and then they respond really well. So I'm sure you are all thinking, okay, this is spinal traction. No, it's not spinal traction at all whatsoever. So there's a complete big difference to spinal decompression and spinal traction. So in spinal traction, it's a table just like this, maybe not as wide, not as big, but what spinal traction does, spinal traction, it pulls and pulls and pulls. It doesn't do anything else. It just pulls the entire spine and doesn't focus on the main level that the problem is, whether it's L1, L2, L3. That's the lumbar unit, so I'm just going to discuss the lumbar unit, where spinal decompression, this table comes up, and if you look over here, there's buttons over here where it says L1, L2, L3, L4, L5. This determines angle. So based on what angle we're putting the patient at, that's where it's pulling that patient at that one level. So if it's L1, it could be 10 degrees, where in traction, it's just pulling everything, where when we have it at one angle here in decompression, it's focusing only on that particular level. That's what makes spinal decompression different to spinal traction. Another mechanism that spinal decompression does is it has a pumping mechanism along with that pulling. That's what helps rehydrate a disc and help reform its shape, where in spinal traction it doesn't have that pumping mechanism. It just keeps pulling and pulling and pulling and pulling, and that can cause a lot of muscle spasms. Now, after a patient goes through our a treatment of spinal decompression, we put them on some stems, like a TENS unit, just to relax any muscles in there, and then we instruct them, go home, do some stretches, do some exercises. We give them a belt to put some ice on. It helps reduce the inflammation. Now, they do that in spinal traction too, but it's not through the full rigor mortis here. Now, at our facility specifically, it's a protocol here. It's a program. It's not something that's just by the visit. Spinal decompression isn't a one and done type of treatment, just like chiropractic isn't a one and done type of a treatment. So how do we determine if someone is a spinal decompression patient versus a chiropractic patient or a neuropathy patient? Every patient goes through an exam. That exam is very thorough. X-rays, neurological examination. So we sit down and talk with patients about their issue, and that helps us determine what category they need to be in. MRIs really help out as well. Do we need an MRI? No, but it is very helpful because it tells us, whether it's the report or the disc, It helps us determine where the disc bulge is actually at, where spinal stenosis is at, how much degenerative disc disease this patient had. It's not a definitive answer. Our neurological exam is going to be our definitive answer. If someone's in severe pain, their history, I've been in pain for 5 years, nothing's helped. Yeah, you're a decompression patient here. So the protocol works, a lot of different offices are really different. The goal is to get 30 visits in. Patients typically respond pretty well within the first 5 visits. The first couple weeks, we want you coming in every day, because the more that you come in, the more that your body will start to respond to care. Just like in chiropractic, the more you come in, the more frequency there is, the quicker your body will respond. So that's how our protocol works. But again, we're not gonna just say, okay, you're a decompression patient. We won't put a patient on the table until we see x-rays, until we see an exam, because we want to know exactly what's wrong with that patient. So that's what I have for you on decompression today. This is probably one of the most crucial videos that you'll listen in all the blogs that I'll do from here on out, because this is modern technology. This is what will get patients better. I'm not saying surgery is wrong, but we just see that higher success rate. With a 93% success rate compared to surgery's 20% success rate, I think I know what route I'm going to go. So I really urge you, if you or somebody you know is suffering in pain, someone who just can't take the pain any longer, please, please, please reach out to us. I'm going to share this on Facebook. It's going to be on Instagram. It's going to be on Twitter. This is what can help you live the life that you want to live and the life that you want back. So that's all I have for you guys today. If you have any questions, I please urge you, please reach out to us. We'll be happy to answer any questions. We'll be happy to sit down with you and talk about the issues that you've been having. Have a good day.